The Dr. Taz Show, the podcast. Dr. Taz, Superwoman Wellness. Here's Dr. Taz.
Welcome back, everyone. Welcome back to this episode of Superwoman Wellness, where you know I'm determined to bring you back to your superpowered self. And joining me today is a special guest who is going to answer some questions that many of you have been asking me. I have Dr. David Adamson with me. He's the Medical Director of Equal3 Fertility, a clinical professor at Stanford University, and an associate clinical professor at the University of California in San Francisco. He's past president of ASRM, SART, I'll let him tell you what all those acronyms are for, and the Committee on Reproductive Medicine, and is founder, chairman, and chief executive officer of Advanced Reproductive Care, the largest United States network fertility company. Welcome to the show, Dr. Adamson.
Thank you very much for having me, Dr. Taz. It's nice to be here.
I am excited to have you for a very simple reason. A, to get your expertise, of course, but also I think women are really scared right now. I have been taking all kinds of calls from, my reproductive endocrinologist canceled my IVF cycle, to should I get pregnant right now, or I am pregnant, what does that mean for my prenatal visits? So tell us a little bit about what's happening to this field of trying to get people pregnant, trying to help them with creating their families and bringing them that happiness, and COVID-19 and pandemic and shutdowns and all that other stuff. Give us a sense of what you're seeing and maybe the logic and the reasoning behind it.
Great. Well, there's a lot of questions there, and I think the first thing to say is that there's still a lot we don't know about this virus, and it's a whole new world for everybody, whether it's about their home and family life or their work life or their medical care life. So, it's a very uncharted area that we're in for everybody. That said, I think there is some good news out there, and I'll give some general comments and be really happy to answer in more detail. But, generally speaking, if a woman is pregnant right now, she can be reasonably comfortable that the pregnancy is probably going to do okay and she'll be fine, and she should be hopeful about that. At the same time, there's a lot we don't know about the impact of this virus on pregnancy. I'd say the most important thing that a woman can do if she's pregnant right now is to try to avoid the virus. Because even though we don't think the virus crosses the placenta to directly harm the baby, there's not much question that if a woman gets sick with this virus during pregnancy and she's really, really sick, that this can have untoward consequences for her, of course, but also for the baby, and may result in an early delivery, premature delivery, or other complications of pregnancy. Any woman who has a really serious illness is going to have potential complications to her pregnancy. So it's important not to get sick if you're pregnant, and then I'd say communicate a lot with your doctors. That's just a general comment about the people who are pregnant. I think they should be comfortable, but they need to be really, really careful to do all the things we know about to self-protect to avoid getting the coronavirus.
Wow. So, I know that's important, and, pregnant, for everyone that's pregnant out there right now, I think taking those precautions that you've heard a lot of us talk about over and over again, from hand washing, hand hygiene, social distancing. I'm advocating wearing masks. I think it's just a layer of protection for sure.
Yes.
And then even making sure from a nutrient, antioxidant standpoint, gut health, all those markers of sort of your immune system are where they need to be. But some women are getting really concerned. They pay a lot of money. There's a lot of emotion tied up in their IVF or IUI cycles, or, their reproductive cycles, but then they're canceled. Tell us the logic in canceling some of these procedures, in this pandemic, and what that means for them, down the road or after the fact.
Right. It's very interesting what's happened, and there are always some silver linings that come out of these types of situations. It's been very difficult for people with infertility, because infertility is a disease. It can be a major life crisis affecting people biologically, emotionally, psychologically, and certainly financially. So it's a very, very challenging situation to be in to start with. And then when you layer on top of this, the COVID-19 and all the issues just happened and affected everybody, that makes it really, really difficult. And then all of a sudden, their fertility treatment gets stopped as well. And this has just, really been extremely difficult situation for most people who are, struggling with getting pregnant when they want to get pregnant. That said, there were some pretty good reasons why the ASRM stands for the American Society for Reproductive Medicine. It is, the absolutely number one reproductive medicine society in the country. Consists of, 7,000 or 8,000 professionals, physicians, scientists, embryologists, nurses, et cetera, psychologists, mental health workers. So it is the organization for reproductive medicine. They have some very, very bright and committed and altruistic people who participated on a task force that ASRM set up right away. And this task force looked at the issue of what should we do? I mean, just as everybody else was trying to decide what to do, they looked at this and they came up with recommendations that would be really over, 6-7 weeks ago now, almost not quite a couple of months ago, but a couple of months ago, that said that all fertility treatments should stop except for real emergency ones, meaning women who had to go for chemotherapy for cancer and needed to freeze their eggs and situations like that. But that they also said that people who were in the middle of treatment could continue their treatment and finish it, which would usually involve, another week or 2 weeks of treatment. They also recommended freezing all the embryos in IVF cycles then, so as not to put them back now and create a pregnancy now. And there were good reasons for doing this. I mean, the first reason was that nobody really knew what was happening, and we were going into uncharted waters. The second reason was there was legitimate concern about the possibility for women who are undergoing treatment to get sick themselves, to get COVID if they were coming to doctor's offices and other patients were there. And so there's concern about the patients getting sick with coronavirus, about staff getting sick with coronavirus. And as you know, there was huge concern about whether we'd have enough PPE and whether we'd have enough medical facilities, whether we'd have enough doctors to deal with this, impending surge, which in many ways didn't really occur except in a few areas. Certainly it did in New York, but in other areas, probably it was put off because people did do social distancing and hand washing, whatever. And there were, of course, also concerns that if a woman did get pregnant now, what impact would that have on the baby and early pregnancy, which we can talk about, but nobody really knew. So there was a concern we could get a woman pregnant and then she could have the pregnancy she really wanted, but the virus could harm the baby, damage the baby in utero. And of course, on top of that, there was really a societal sort of ethical issue. If all sorts of people are not having other surgeries done, they're isolating at home, people are losing their jobs, there was a lot of suffering and harm going around our society, and there still is today, of course. But it seemed that even though this was a real burden for infertility patients, it was sort of part of, social justice or, equal participation in trying to manage this, to reduce the spread of this. So there were a lot of reasons they chose, and I think they were good reasons. I think they made the right choices. Obviously, that doesn't mean it was difficult, because it was very, very difficult for people. But it's changed now. The good news is it's changed.
So I was about to ask you that. I know I've had many patients who are upset about it or stressed about it. Things are easing up now, correct? And
Yes.
Things are resuming when it comes to them. So I'm curious, I mean, one of the things, because I see a lot of infertility in my practice as well, which is a integrative practice, and we work with, local reproductive endocrinologists. What, in your opinion, are some reasons women have been having so many issues with infertility? I feel like it's a little bit of an epidemic to a certain extent. And what are you guys advising when it comes to getting ready for pregnancy or even getting ready for infertility treatments?
Right. I know, Dr. Taz, you're really committed to wellness, a holistic approach. So I'd like to take a really holistic approach to your question.
Okay.
Yeah.
I like that.
And that holistic approach is that I think all women and men, by the time they hit university or so, just as they're thinking about where they want to go to university, what kinds of courses they want to take, where they want to work, what kind of jobs they'd like, type of, people they'd like to have relationships with and what have you. In other words, they're planning their lives. It's really important to start planning your reproductive life when you're 20 or 21 or 22. That doesn't mean that you're going to have a baby next year. It means that you get the information, get the facts, and realize I won't be able to have a baby forever. And there's optimal times biologically to have children. And these, of course, times can conflict often with education or work or what have you. So it's not that you have to make decisions at that point, like I'm going to have a baby at 28 or 34. It's not that. But you want to start integrating thinking about your reproductive life into the other parts of your life, your economic life, your geographic life, your relationship life, your social life. What are the things that matter to you? And do you want kids at all or not? Maybe you don't. That's okay. And in what type of situation? So I would encourage people to do that. Secondly, as they go through the early parts of reproductive life, let's just say the 20s, it's really, really important to manage your health, which I know you'll really, really agree with that. And it's important for everybody, but it's especially important when you're young for a couple of reasons. One, if you develop good habits in your 20s, it'll be a whole lot easier to keep those than to break all your bad habits when you're 40.
Right.
So start with good habits when you're younger. The second thing is that reproduction is a major life activity. In fact, one could easily argue that for any life form, it is the most important life activity. And as a result, reproduction takes a lot of an individual's resources. It takes time, it takes money, but it takes an emotional toll and it takes a physical toll. It takes energy to reproduce. So it's really important to practice good health habits, the diet, exercise, sleep, some mind-body work with meditation, all the, the good things we know really, really matter for living a healthy life. And so these habits, if developed in the 20s and early 30s, will really prepare a woman and a man for having that baby together, for the pregnancy and then looking after the baby. So diet, exercise, sleep, which is very underslept country, so sleep is something people often ignore, are really important. Obviously, a good appropriate multivitamin supplement is good. People want to not be smoking, obviously. It would seem that a little bit of alcohol is okay. That I'm not promoting alcohol, but I'm not telling everybody they have to become teetotalers either. A little bit of alcohol is okay, but obviously when women are pregnant, not to have any alcohol at all. Smoking is universally bad for people and for babies especially. And social drugs are not helpful at all and can be very, very harmful. And without putting too fine a point on it, safe sex matters, because if a woman gets infections when she's younger, then she can end up with infertility from adhesions, whatever. And the other issue is to see your doctor, get a good healthcare doctor, primary care doctor, an internist, integrative doctor, gynecologist, somebody you can see over time who knows about you, and you can take your health problems to them and get them treated early. One of my big areas is endometriosis. So if you're having pelvic pain, it's not normal, go see your doctor. So start taking care of yourself when you're younger, develop those good habits. And when the time comes to have a baby, you'll be in a much, much better place to have a baby.
I think those are all such important points. I mean, oftentimes people come to my office, and they're already deep into a particular issue. And so it's a lot of rewinding and unwinding, and then the patience of time is not there, or there isn't time. One thing I've noticed, so it's really hard, and I think we've both been in that situation. When I was in my early 20s, it took crashing to really get me to be serious about my health. And I was in med school and residency and all these other things, and it didn't really click for me that I needed to worry about my own health until about 28. And that was because cosmetically I was going downhill. It's so sad. It wasn't like the joint pain or any of the other things. It was the fact that I was losing hair and having acne. So how do we drive that message home to these younger folks? And is there, a lot of times I'm like, is there a test I can say every 20-year-old needs to do this test, and have a way to measure like where their health is? Like, these are the 3 things you should always check. And I know I have my ideas, but from a fertility standpoint, is there something, because that's a message I think women would resonate with, and men, because I think at some point people, do want to have a family. And if they understood like the connection, like, hey, adopt these behaviors, it'll affect these numbers, and that will impact your ability to have a family down the road. I don't know if there's something you've seen, in your experience that we could latch onto and get that message to them a little bit better.
Well, I think that the message that you're delivering and I'm trying to deliver here is that your health really matters, and we both know, and I certainly know. Maybe you don't know it yet because it's based on age, but basically you can do anything to your body you want till about 40, and your body takes care of you. But I'm clearly over 40, and once you hit about 40 or so, the body starts taking back, and if you haven't been looking after yourself, you start to pay a price for it. Whereas up till then, generally speaking, you can pretty well get away with a lot of things, and your body sort of deals with it. But as you get older, this gets tougher. So I think the real message is take care of yourself. I mean, take care of yourself physically, mentally, emotionally, spiritually, what works for you. But I do think it's really important also specifically to your question, to get a doctor you're comfortable with. And I don't think it matters if it's a, general practitioner, primary care doctor, an internist, integrative doctor, a gynecologist, obstetrician, gynecologist, but a primary care doctor gets to know you as a person. And you can tell them when you're not feeling well. And of course, there will be some specific blood tests, even in your 20s, that, you'll generally want to get every once in a while. You don't need them every year like you might need when you're 60, but you're going to need them, once in a while when you're younger. And really importantly, if you're paying attention to your body and what symptoms you have, and you go to your doctor and mention those, they'll be able to help decide what kinds of tests. So in general, to specific aspect of your question, obviously general hematology and biochemistry tests is necessary, but really based on your health and, what other tests might be indicated. You might have thyroid problems, or in our field, acne problems if you're getting thyroid or prolactin problems. If you're getting acne, you'd consider androgen tests, of course, looking into that. And it's important if a woman starts having really irregular cycles. Maybe she's got polycystic ovarian syndrome. If she doesn't have periods for a long time, she could have, hypo or hypothalamic pituitary amenorrhea or some other problem. We all know if she's too heavy or too light, anorexia or obesity are really not good, and menstrual periods won't be regular. So if a woman's not having regular menstrual periods, that's a real sign of health, right? Overall health, because to have regular periods, a lot of things have to work properly. So if a woman's not, it's a real sign clearly that something's not quite right, and she should, see her gynecologist or doctor about it, and, find out why is this happening so that you can deal with those problems. Now, there are some blood tests out there, and frankly, some of them are pretty strongly promoted as, get an AMH test or get an ultrasound for androgen follicle count, whatever. The reality of it is that I think screening for that, by and large, for women in their 20s is not going to be a very productive exercise. It doesn't, in isolation, really tell you that much. Now, again, if a woman's not having regular cycles, if she has a mother that went through menopause at 34, or if she's very, very short and might have mosaic Turner syndrome or something, this is where I'm saying if you have a doctor and you give them a good history and you look at your family history and you look at what's going on physically, you will find ways to do directed tests to look for problems. But there's not going to be one general screening test you say everybody should have this. Now that gets different, of course, you get older, right? As you get into your 30s and you want to have a baby, and a woman's 32 and says, well, I don't want a baby now. I want to wait till I'm 38. And she only has 3 periods a year and she's normal weight. You might be thinking, and she used to have regular periods, you might think, well, gee, maybe this lady's having earlier loss of her eggs, and we should do an AMH and a antral follicle count and see what's going on, or do whatever other tests. So again, I think the person taking care of themselves, first of all, and part of that is education and awareness. That's really important. Pay attention. I mean, people spend a lot of time looking up fashion and looking up cosmetics and looking up social things. And that's all great, right? But spend some time looking up about your health. So you can work that, and then get a doctor and work together. And I think that's the best way to move forward and make good decisions, and talk to your partner, right? So that the two of you can make decisions together.
Such important advice. And I hope for any of you out there who are listening who are in your 20s, and I so want you not to have the journey that I had. So please take your health seriously, pay attention. I think things like your periods and your skin and your hair, they're all vital signs. They're ways of checking in. You know, in Chinese medicine, they're adamant that your period is a life force. They call it a qi. And when it starts to go away, then it's your overall health that's at stake. And I think adopting that principle and understanding that, and also in Chinese medicine, as you probably already know, giving birth is a big deal. Getting pregnant is a big deal. It's not like, oh, I got pregnant, oh, I had a baby. It's like sacred and important, and the body was supposed to be nourished and protected, and the woman was supposed to be protected. So we've gotten really far away from some of those concepts that we now know even in science hold true. I have a curious question. So I have a lot of stressed superwomen. That's probably the best way to say it. So a lot of stressed superwomen that cross my path. Is it stress or is it age that is the ultimate infertility block?
It's definitely age. Age is number 1, 2, and 3 on the list.
Okay.
And it's certainly true that many people with infertility are very, very stressed. The general sense to this is, based on the best science we have, is that what happens is, if a woman, or a man has infertility, they can become very, very stressed. It's also true, of course, if a woman becomes very, very stressed for other reasons, we know that can interfere with the menstrual cycle and can interfere with her ovulation. So if you have a woman who's very, very stressed and has irregular menstrual cycles, or she's very thin, or she's very overweight, it definitely could be that these, other factors are sort of combined. So the stress is sort of part of the whole picture. But it's not generally true that if you have stress, you're going to have infertility. The thinking around that, led to comments like, have a glass of wine to get pregnant, go to Hawaii, have a vacation to get pregnant. And so that's not true. It's very important to know that's not true. So generally what happens, the infertility or reproductive issues come first and the stress comes second. But there's no question that you can't separate out the physical body and the intellectual body and the emotional body, completely. I mean, they're clearly all, functioning together. But it's not true that stress per se mostly causes infertility. It's true that infertility is almost always very stressful.
And what is that age cutoff that you are seeing currently? And I know what it was in my time, but what is the age? Like we know 50-year-olds who are undergoing IVF. Here in California, we have so many celebrities that we see having babies very late. So what is that age? And I think, by the way, that gives, a woman out there maybe a artificial sense of security that, I can wait till I'm 50 and I can wait till all this other stuff. So what is that age realistically that you would recommend that women really, after that, it becomes very difficult?
So I'm going to simplify your question a tiny bit and make a tiny bit of an approximation just to make it easy to remember. But basically, a woman has normal fertility up to about age 31. So let's just call it 30. So up to age 30, doesn't matter if you get pregnant really at 26 or 29. This is a bit of an approximation, but essentially true. But between 31 and 34, fertility goes down about 10%, and it goes down another 8% the next year, or 9% and 8%. So the bottom line is, at age 34, a woman's fertility is about 1/6 less at age 35 than it was at 30. So it's 1/6 down at 35. And basically by age 40, it's down by half. So 1/6 of fertility is lost by age 35, another 2/6 by age 40. And by age 42 or 43, it's down to 10% or lower than that. So there's a huge drop off after age 38. So from about age 39 to 41, 42, huge drop off. Then after age 42, very, very few women get pregnant, on their own. So you certainly hear women do, but once we get to women in the 43, 44, 45, we're looking at live birth rates, even with in vitro fertilization, and the 1% range, and
Wow.
1 or 2. It depends on other factors, but it's something around 1 in 100, which is clearly terrible, right? I mean, it's terrible in terms of the
Right.
probabilities. Now, we're delighted when it happens. That's why most women that age will end up using donor egg if they really want to have a baby. And so one of the really great things about assisted reproductive technologies enabled women to have babies when they're older, and if they
Right.
had ovarian failure where they didn't have eggs, they had their ovaries removed for cancer or whatever, they could still get donor eggs. You can get donor sperm, have a gestational carrier. That's all good. But one of the bad things about it was that people started reading about 51-year-olds having
Right.
babies and said, oh, I can have a baby at 51. Well, of course, those women all used donor egg. I mean, the oldest woman in the world to have a baby with her own eggs is, reported somewhere to be 56 or 57.
Right.
To give you an idea, there's, about 4 million babies born a year in this country. It's a little bit less than that, but about 4 million. And about 1 in 400 are born to women over age 45.
Mm-hmm.
Okay, so that's 1 in 10,000. So it's important to know that having a baby over 45 almost never, ever happens. And the reality of it is about half of the women at age 40 will really have difficulty getting pregnant with their own eggs, and in fact never will get pregnant with their own eggs at age 40. So at 35, 5 out of 6 are going to get pregnant, and at 40 it's only half. So you can see why that 35 to 40 range is so important for, if you want babies, you definitely don't want to be waiting after 35. And the best biologic choice, and we understand there are lots of other factors in this, but by age 30, if you really want children, you should be thinking about how you're going to integrate it into your life.
I think that's so important. As women, I think, many of us are raised to accomplish, to succeed.
Yeah. And
it's almost like we weren't raised with, there's a timeline to your fertility, and some of us almost resent it. Like, what do you mean there's a timeline to my fertility? But I've sat with so many women who haven't thought about it, and, things could have been different for them if they have. And so I think, like, to your point, just like financial health and so many other factors, we have to think all the way through. We have to think long game. And I don't know, I think it just needs a lot more conversation, because I think there's certain areas that we never talk about, and we focus on specific numbers or accomplishments more so. And then many women and men end up very unhappy, down the road. So one more question for you. With the pandemic, and we don't know what the economic conditions are going to be like down the road. They don't look great right now. Assisted reproductive, endocrinology, all these procedures and things like that are really expensive. And I know I've had patients where their parents have paid for it, or they've saved up for years. What does it look like economically for these procedures down the road, and what should couples do if they're in a position where they have maybe lost their job and they're running out of time because the clock is ticking on their age? What is your advice to them?
Well, I have to comment about the cost part of it, and we don't have time. We could spend a whole show on this, but I don't think IVF is, quote, expensive, end of quote, per se. If you compare it to other medical services or other services in society, it's not. I mean, it's a very intensive, high resource service to provide. The problem is it's not affordable, and it's not affordable because it's not supported by, insurance and society. I am personally very committed, as are others, to getting better infertility coverage through employers. That's very, very important. And so I would reframe it that it's not that it's expensive, because I think there's true value for money. And who would argue that the cost of a baby in this country through IVF, the way they do these calculations, is $40,000 or $50,000. So I don't think there are many people that wouldn't argue a baby's worth $40,000 or $50,000. That's doing a couple of cycles of IVF and what have you. Approximation. So the problem is it's not affordable. And so the first thing is we do need to get better coverage, and people should go to their employer and say, you don't have coverage. I think we should have coverage. And so we want to really focus on that. The second thing is there are certainly programs within the clinics, and our company, Fertility, has programs where we package evidence-based care, and then we can do financing for it. So we can make it affordable. So just like you sometimes borrow money for a college education or a car or a house, we don't think of having to borrow money for healthcare, but you can borrow money for healthcare. And, we have unsecured loans. So the thing is to start to plan. So if you're going to, have a baby, you should be thinking about money anyway, because
Right.
babies
Oh,
cost
yeah.
money. They have to go to college. So start saving your money, start thinking about that.
Right.
Because that's really, really important. Look at your finances. Do you have anything saved? What are your debts? Pay off, high interest debts. Check your credit score. Make sure it's good. Get that cleaned up. See if some ways you can cut money by not spending maybe on unnecessary things that are nice but not really that important relative to having a family. So think about organizing all of your own finances. If necessary, see a financial counselor or expert in that if you need that kind of help. So start with your own situation. Then, when you get to a clinic, or you can certainly go online and look up areas, places where you can get a loan. And certainly, our company's one of them. We've been around since 1997. We've helped tens and tens and tens of thousands of people have their families. So we're very, very proud about that. And, we have unsecured lending. And so people can get the money for this, but they want to start to plan now, because the economics, really are important about it. And then they see their doctor and talk to them about what the best care is for them. So the thing is, start now and plan, just like you do for other areas in your life. And there's a really, really high chance that this will all work out well for you.
I love that. And planning seems to be the key. And we have covered a lot, from money to babies and getting healthy and being holistic and more. I want to thank you for taking time out today to educate us all
Thank
on
you.
the world of infertility and IVF and everything in between. I think it's such an important issue for women. And for all of you who are listening out there, please remember that this is something that probably somebody near you is dealing with and may not even want to talk about. So maybe share this podcast episode with them, maybe reach out to them, that it is a silent struggle for many couples, and there's a lot of shame associated with it, and there really shouldn't be. So Dr. Adamson, thank you for joining me. If anyone wants to reach out and get more information from you or connect with you, what's the best way for them to do so?
Best way to go to www.arcfertility.com, and you can reach us through there.
Fantastic. And for everybody else, thank you for joining this episode of Superwoman Wellness. If you enjoyed this episode, please rate and review it and share it with your friends. Remember, we're on Spotify as well. And I'll see you guys next time. Take care.